Happy New Month, maternity liners. I'm truly excited to welcome you into this brand new month, the month of May. And as always, Lagos, thank you for always tuning in. Thank you for always showing up. And thank you for always being a part of this powerful community of women, families, yes, of course, and health champions. All right, Lagos, I am Zaynab Yakin. If you're just listening in for the first time, yes, this is Maternity Line Show. This month on Maternity Line, we are recommitting to what truly matters, open conversations, real experiences, and solutions that can make a difference in maternal and child health in Nigeria, of course, beyond Lagos. Okay, and don't forget, every week from 12:15 p.m. all the way to 1 p.m. That's where to catch up this conversation. Also, you can catch the conversation on our website at www.nigeriainfo.fm. We are up and running on social media at Nigeria Info FM on X, at Nigeria Info FM Lagos on Instagram. Lagos, visit our website once again, www.nigeriainfo.fm. Okay, before I dive into today's conversation, I would love to ask you, or let me check if my guest is online already while I'm asking you this question at the same time. All right, Lagos, have you ever been in a situation where a hospital turned you or your baby away in an emergency? What happened? How did you handle it? If you were told your baby, your jaundiced baby couldn't be treated due to lack of power or say space or no space, no power, you know the Nigerian situation now, what would you do? Should hospitals be penalized when they reject newborns in critical condition, right? What immediate action would you take if you noticed your newborn had yellow eyes or skin but couldn't get hospital care? I know as a mother, your mind will be troubled. Yes, so we're having that conversation today, and I'm not doing this alone. I am doing this with our constituency chairman. When I say constituency, you should know already that I am talking about no other person but a noisy Naija pediatrician. That's Dr. Renner Ayodele, who is a medical doctor, also a consultant pediatrician with over 11 years, right, in this journey. Critical, active clinical work, research, and training. Is also a social media influencer. We'll be right back right after this break, Lagos. Stay here. Dr. Renner will be joining us shortly.
To this. It's tasty, creamy, and nourishing. It's original Niger yogurt. It's Fan Yogo. Go for the new Fan Yogo drinking yogurt. Fan Yogo, original Niger yogurt.
To take control of the money where you make and wetin go happen next, now the cocoa of life for plenty people there. How to manage their money? They start with how them they run things with their partner. But true, plenty says they inside family planning. When you do family planning, you go fit to use Confido, take the run things with your partner. On that move, you go get plenty joy as money where you they make go reach you spend, and your health and your well-being go they protected. No tanda the look make you join body with plenty people them. We don't discover the joy when they inside of family planning for Lagos. Remember, say you fit to choose from different plans where they available and make everything sweet for your future. Visit your health center today. Oh yeah, make this move now. Make your future day full with happiness and the good health. Now the Challenge Initiative, TCI, and Development Communications Network, DEFCONS, do this message.
For 3 great seasons, the fans have fought with passion and fire, their best they brought. The banter was bold, the debates were tight, each word a weapon, each match a fight. But now it's bigger, the stakes much higher, the battle returns and it's full of fire. Fan Battle 4 with Femi and the gang on 99.3 Nigeria Info. The stage is bang. In partnership with Sports Salon, we raise the game with Gloriana and a shot at fame. Think you've got what it takes to score? Step right up. It's time for more.
Live auditions for Fan Battle 4 are on Saturday, May the 10th from 10 a.m. at Nigeria Info Studios, 267A at Tim Ian Crescent, Victoria Island, Lagos.
Fan Battle 4. Let the battle begin.
It's tasty, creamy, and nourishing. It's original Niger yogurt. It's Fan Yogo. Go for the new Fan Yogo drinking yogurt. Fan Yogo, original Niger yogurt.
To take control of the money where you they make and waiting go happen next. Now the cocoa of life for plenty people there. How to manage their money? They start with how them they run things with their partner. But true, plenty says they inside family planning. When you do family planning, you go fit to use Confido. Take the run things with your partner under the moon. You go get plenty joy as money where you they make go reach you spend, and your health and your well-being go they protected. No tanda the look make you join body with plenty people them. We don't discover the joy with the inside of family planning for Lagos. Remember, say you fit to choose from different plans where they available and make everything sweet for your future. Visit your health center today. Oh yeah, make this move now. Make your future day full with happiness and the good health. Now the Challenge Initiative, TCI, and Development Communications Network, DEFCOMS, do this message.
For 3 great seasons, the fans have fought with passion and fire, their best they brought. The banter was bold, the debates were tight, each word a weapon, each match a fight. But now it's bigger, the stakes much higher, the battle returns and it's full of fire. Fan Battle 4 with Femi and the gang on 99.3 Nigeria Info. The stage is bang. In partnership with Sports Salon, we raise the game with Gloriana and a shot at fame. Think you've got what it takes to score? Step right up. It's time for more.
Live auditions for Fan Battle 4 are on Saturday, May the 10th from 10 a.m. at Nigeria Info Studios, 267A at Tim Ian Crescent, Victoria Island, Lagos.
Fan Battle 4. Let the battle begin.
.3 Nigeria Info.
Your number one station for talk. Let's talk. Let's talk.
Lagos 99.3 Nigeria Info. Zaynab, let me tell the people that they need money, okay?
Yes, it's very important.
Exactly. Lagos is Jackpot Friday, and there's money everywhere on here, Nigeria Info. And if you want to take part in all of this, my dear, it's so easy. All you have to do is dial the simple code or just go to the website, and that's it. You will be on your way to winning some of that cool cash. If you're wondering how much are you able to get, it's 50K. Oh, that 50K, you cannot pick it from ground. I'm sorry, my dear. You cannot pick it on the ground, and it's a Friday, which means money is needed this weekend, okay? So, like I was saying, all you need to go is go to the website www.oneplay.ng. That is the website. Or use out the code *347*880*3#. Now, when you dial this code or you go to the website, you pick a station Nigeria Info. Play with as little as 500 naira. That's the least amount you can play with, all right? And in a few seconds, your ticket will be in the draw, my dear. The more you play, the better your chances of winning every day. There's money to be won on Money Crossfire, WhatsApp Lagos, Sunnyside, Game On shows, weekday, weekend, money everywhere. And today, being a Friday, it's a 50,000 naira jackpot happening on each of these shows. So they will do the draws, and one play will call you within 24 hours. You get your money. All right. Playing during the week automatically qualifies you for this weekly jackpot. So if you've played during the week and you didn't win, well, this is the time to top it up because it might just be your lucky day. Your chances of winning are still the same whether you use the website with your smartphone, which is www.1play.ng, or with your small phone, your touchlight phone, yes, or with your dataless smartphone. You can type *347 *880 *3 hash. Either way, data no data, money is yours. Okay, remember to play responsibly. Remember to tell a friend because you never can tell where the money is coming from. If you're under 18, this gist was not for you. Don't say I did not tell you. Okay.
All right, Kemi, she has just told you we have money we are giving away on Nigeria Info 99.3, and Kemi always has that information. You might want to stick around because she's definitely going to come back. Right, Lagos, welcome back to the show. It's Maternity Line Show. Big shout out to my general manager, Mr. Femi Obong Daniels. While the ads was running, I was trying to get myself introduced. With my guest, getting personal and all of that, and he had to call me Zaynab. Something is wrong. Thank you so much, boss. Thank you so much, sir. Now, Lagos, listen to this because we need to build a background to the conversation we're having today. I'd asked questions before we went on break, and before I bring in my guest formally, have a listen to this.
Nàìjíríà wa ojoojúmọ́ ló ń wọ̀ sí Ọlọ́run ọba nìkan ló lè ṣàánú ẹ wo láti àárọ̀ tó ti ń gbé ọmọ yẹn kiri ṣé wọn pé tó bá gba ọmọ yẹn tó fún ní first treatment nǹkan kan lè máa ṣe mí dẹ̀mọ̀ kó lágbára Ọlọ́run kan kò ní ṣe ẹ pé ayé Nàìjíríà wa yóò ti bàjẹ́ pátápátá.
All right, you might want to listen again for the purpose of those who do not understand Yoruba. Don't worry, I'll translate. Just give me a moment. One more time, have a listen. To waste of time, okay, on the show because we never have enough time. So, a newborn with jaundice was reportedly rejected by 4 government hospitals in Lagos, including Ikorodu General Hospital, Luth Massey Children's Hospital, and FMC Ebute Metta. Now, the mother, in a desperate state, shared her story on social media, claiming that even at a private hospital in Surulere, the baby could not be placed in an incubator because there was no electricity. Now, this story has sparked outrage and raised critical questions. Why are babies in critical condition being turned away? What emergency protocols exist for such cases? And what should parents do when every second counts, but help is nowhere to be found? Now, joining me on this conversation today is Dr. Renner Ayodele, the popular noisy Naija pediatrician, a renowned consultant pediatrician, to shed light on this critical topic. Dr. Renner Ayodele, good afternoon once again.
Good afternoon, Zaynab, and good afternoon, listeners. Good afternoon, Lagos.
All right, doctor, you heard me, didn't you? Did you hear me while telling the story? Now, doctor, let's start by understanding the condition. What exactly causes neonatal jaundice, and how common is it among Nigerian newborns?
Okay, Zainab, neonatal jaundice, let me start from how common it is. 70% of newborns in the world, 70% of newborns born in Nigeria will actually have jaundice. So out of 10 newborns that are born, 7 of them are going to have jaundice. Now, what causes jaundice? Jaundice essentially is when the skin and eyes of a baby turn yellow as a result of accumulation of a substance in the blood that we call bilirubin.
Right.
Now, this bilirubin can accumulate for a lot of reasons, some of which are just a natural process of the baby transitioning from inside the womb to the outside world, and some are disease conditions that make that bilirubin rise in the level of rise in the blood of the child. And so differentiating the one that is the natural transition type of high bilirubin from the one that is disease condition is something that the healthcare professional must do. And it is difficult for the parents to be the ones to do that. So the essence of managing a child with jaundice is to identify the one that is what we call physiological, which is the natural process, and the one that is pathological, which are the ones that come from disease conditions. And so that essentially is what I think we're going to be discussing along the way during this program.
Okay, so essentially, in summary, what you have said so far, are you establishing the background that ideally a parent or no parent is meant to take care of jaundice at home, manage jaundice for a newborn at home? Wow.
That is exactly what I am saying. A parent should not manage jaundice at home. When jaundice is noticed, how do you know that it is the jaundice that is the physiologic type or if it's the pathological type? It has to be the hospital that will determine that. Because I think a lot of people, because even when you sent me the post, I went to the post and I started reading through the comments.
Right.
And I started seeing things like pawpaw water, people still actively advocating for the use of pawpaw water to manage jaundice. Not more irresponsible or dangerous than suggesting such preposterous modes of management of jaundice in 2025. I have seen children time and time again that have come to the hospital, their brains already damaged. And this is a brain that the child has barely used for up to 1 week and it's already been damaged by jaundice. And the parents are going to have to live with the disability the child is going to have for the rest of that child's life. It is unimaginable to me that people are suggesting something as ridiculous as pawpaw water in this time and age.
I love the fact that you've delved into the use of pawpaw water and the rest of them, because people strongly argue, saying that, Kini, why are you going to the hospital? And where you give the baby. And I'm like, okay, a baby, how do you even measure this? Who is taking you through all of this education? Is this something you are hearing from your neighbor or you are hearing from your, perhaps grandmothers? Because our grandmothers are fond of doing this. And you want to find yourself in an argument with them, then it becomes chaotic. So how do we do away with this? How?
So I mean, so you know that this is not my style. I normally don't sound this vehement about stuff. Usually my style is more light-hearted, but I think we need to, press this important information home. First of all, let me just establish the background that every parent wants the best for their child. No parent wants to deliberately harm their child. But the problem is that ignorance will make you do things that even a murderer will not do to your child. You see, the problem is that if somebody has evil intentions for a child, they will make it clear. But the idea that you are trying to do something good for your child and out of ignorance you are doing something that will harm that child makes it even more painful. Now, the idea that pawpaw water, because what they'll say is that, but I use pawpaw water for my child and the jaundice cleared. Now, there's a type of jaundice we call physiological jaundice, in which there is simply the liver of the child is simply not mature enough to handle some of the bilirubin load, and then it transiently rises and then it falls again. It doesn't rise too high and then it falls again. And so whether you give pawpaw water or not, that particular type of jaundice that we call the physiologic jaundice is going to come and it's going to go. And majority of babies will have that physiological jaundice. However, for the ones that will have the pathological jaundice, if you like, go and bring the pawpaw water that they are growing in the heavenly realm and use it. That child is still going to come down with very severe brain damage from jaundice. So how do you know which one is the physiological jaundice and which one is the disease or the pathological jaundice? Parents cannot know this. So to all of you that are saying that, but I use pawpaw water for my child, just be thanking your God, because that child most likely had physiological jaundice that was going to come and that was going to go away by itself, even without any kind of intervention. It was not your pawpaw water that did anything. that made that jaundice to go away. It was the fact that that jaundice was physiological and that it was going to go away by itself. Please do not use early morning sun as a first line of treatment for jaundice. That you notice jaundice and you decide for yourself that you want to be hanging the child on the line inside the sun. I even saw somebody even say, in the comment section on that post that, just put the child under the sun for a few seconds. What is a few seconds of sunlight going to actually do for, jaundice that is going to fry a child's brain? So please, early morning sun is not an option for the management of jaundice. Go to the hospital, have the levels checked, and have phototherapy started for that child.
Thank you so much, Doctor. As much as I would love for us to move this conversation forward, I see us still being on this particular area because you saw what the woman in the video she's saying, that she's been to 4 different hospitals, including the public facilities and the private one, and she wasn't attended to. What could she have done, doctor, in that situation?
Yeah. I really feel like, this is like very unfortunate, when it comes to this sort of situation whereby she has had to go from hospital to hospital. On the one hand, I have a few questions, in the sense that, number one, where did she do her antenatal care? Where was the antenatal care done? Because in a place where they have antenatal care, they have facilities for newborn management as well, and places where this child can be referred to. I feel really sorry for her about the idea that she actually went from hospital to hospital and was unable to get, but at the end of the day, At the end of the day, if the hospitals do not have the phototherapy lights for the child, then they don't have, unfortunately. And so what I think we can do is that we need to strengthen our referral system such that if she gets to a particular hospital, before she leaves that hospital, they can just make a call or put a call through to try to see which hospital has phototherapy lights, so that she can make her way towards that hospital where they would have reserved, some sort of, therapy or phototherapy for her. But that being said, what I see is that a lot of mothers won't go for antenatal clinic. They deliver at home, or they deliver at a traditional birth attendant. Then the first contact that they have with any hospital is that the immunization. And when they now go to the immunization, and then the nurse says that, your child is actually jaundiced, and that usually is at the primary healthcare center where they don't have facilities to manage jaundice. It's at that point that the mother has her very first contact with a hospital system, even since she got pregnant. Maybe sometimes they might actually register in a place, but they will never turn up for any reason. They will deliver at home, or they will deliver at a traditional birth attendance. And so what I would like to encourage a lot of mothers to do is that please register at a hospital, even if it is a primary healthcare center, so that the follow-up newborn care can be instituted, and then the child can be referred to a hospital where they have phototherapy. Or you register at a general hospital. Usually general hospitals always have facilities to actually treat jaundice as soon as the jaundice appears in such babies.
Thank you so much, doctor. I'm glad we've been able to emphasize that area very, very importantly. All right. What are the danger signs parents must never ignore in a jaundiced baby, doctor?
Okay, so Zaynab, so number one, when a child appears jaundiced and they notice that yellowness of the eyes, they have to go to the hospital immediately to have the levels of the jaundice checked, so that we see if it is normal or if it is very high, because it is not every child with jaundice that we are going to admit. We take into consideration the age of the child and how high the level of jaundice is, but we will always monitor until we feel that the levels are safe. 2 is that, unfortunately, by the time a child begins to show symptoms as a result of jaundice, there is already brain damage going on. But the brain damage can be mild, it can be moderate, or it can be severe. With mild brain damage, the child will be excessively sleepy, they will refuse to suck, or they will suck poorly. By the time the brain damage begins to progress and worsen, the child might become unconscious, they might begin to have seizures and abnormal movements, and they can actually stop breathing and actually die. So by the time a child begins to show symptoms of jaundice by way of poor suck, refusal to feed, high-pitched cry, excessive crying, the brain is already being compromised. If the child has some sort of intervention early, then it can be reversed. The main goal of treatment of jaundice in any setting is to prevent brain damage.
All right, doctor, thank you. We are still coming back to for more questions, but I would love to bring Lagos at this point. Bring Lagos in 020127709930 0201465790. You can as well drop us your message on WhatsApp 0809-597-5805. Someone has been trying to call. Perhaps he or she has a question for Dr. Renner Ayodele. Once again, 020127709930 0201465790. Parents, be a part of this conversation. Intended mothers, be a part of this conversation. Mothers, be a part of this conversation. Have you ever experienced jaundice with your child? Good afternoon, Lagos. Good afternoon.
Hello.
Good afternoon.
Good afternoon. Lady Zaynab, good afternoon. Good afternoon to the doctor.
Oh, good afternoon, Mrs. Oboli.
So, as the doctor was saying all he was saying this afternoon, my own case just began to play out in my head. I quite understand the fact that the buck stops at the table of the pregnant woman. And if I had known a couple of things he was saying today, I guess the case of my son would have been different. Now, in my own case, I didn't know on time, or we weren't told on time that my child was joining this. So it was until he stopped sucking, I think at about the 5th or the 6th day, he was just sleeping. So at that point, we knew something was definitely amiss. So I had to go back to the hospital, and then he was diagnosed with jaundice. Now, going forward, it was at that same point they said that we would be hospitalized, and before the hospitalization, they told us to get an antibiotic. I don't really want to mention. The doctor knows about it, that it will clear the jaundice. So fast forward, Lady Zaynab, the antibiotics itself was even another problem, because it was not even it was the right one, but we got the same antibiotics with different kinds of odor, different kinds of taste. It was just fake all through. So instead of curing or healing the jaundice or, having as a medication, it was worsening the problem.
Was it prescribed? Was it prescribed at the hospital?
Yes, it was. Ampiclos. That's why I said the doctor knows. And before you know it, rather than, destroy the jaundice, it was prescribed, yeah. So at some point, when it was no longer sucking out, so that was when we were asked to come for the EBT, which is the exchange and blood transfusion. And fast forward 14 years down the line, here we are today. So like the doctor said, in my own case, I did the registration. In fact, I registered in 2 hospitals. I'm an intentional mom that I don't joke with my, antenatals. I did the right thing. But I'm not saying all mothers, but I'm saying if you have done the right thing, and at the end of the day, something goes wrong, I don't think we should blame ourselves that at the end of the day, we as mothers, we are to be blamed. Some people don't do the right thing. Some do the right thing, and it turns out this way. So I thank God for the enlightenment your show has brought this afternoon. But my own child's own was the pathological jaundice, and that was why, instead of everything we did, until the EBT was done, there was nothing, there was no remedy. And this is where we found ourselves. So I just want to say, mine has taught me to also advocate and tell other mothers as well that don't go the way mine has gone. You can do better. Thank you. But all he has been saying only brought, memories I really wanted to forget. Thank you very much.
I'm so sorry about your experience, Mrs. Oboli. My love to your 14-year-old.
Yes.
Dr. Renner.
Yes, I know Mrs. Oboli is one of your regular callers, and
That's right.
she doesn't hide the fact that she actually has a child that has cerebral palsy. And these are one of the long-term complications of jaundice. So when a child has jaundice, it actually affects a part of the brain that controls movement and posture. And so they develop a type of cerebral palsy that we call chorioathetosis. And yes, I'm really sorry about, what Mrs. Oboli has gone through. But yeah, she's very brave, and she always speaks and advocates, for such situations. And I do understand what she means when she says that there are some times when you do everything by the book,
Right.
and yet, unfortunately, the outcome is still unfavorable, and which is, really sad. But what I'd like to say is that, number one, Ampiclox is not the drug of choice. It's not a treatment for jaundice. In some situations, infections in the baby can actually cause jaundice. But Usually, what we do is that when we admit the baby and then we give them injectable antibiotics, not oral antibiotics, once we suspect that actually that child is having an infection. So, two is that when it comes to treatment of jaundice, yes, sometimes exchange blood transfusions are done if the level is high. Even if the child has not developed any evidence of brain damage, we can still go ahead and do an exchange blood transfusion if we think that the level is high enough that the brain is at risk of having some kind of brain damage. So sometimes phototherapy can be on, which is the initial first line of treatment that we give. We put under a special blue light that helps to break down that bilirubin. But when the level of the bilirubin is not being broken down effectively by the phototherapy and it is rising rapidly or it reaches a certain level, then we say that before this brain becomes damaged, we need to do an exchange blood transfusion that will replace the baby's blood with a blood that does not have any of that jaundice pigment in it. And usually that blood is screened, the blood is thoroughly screened for all kinds of diseases to make sure that the blood is safe for the baby. And so that is exactly what we do to prevent brain damage when it comes to jaundice.
All right, doctor, while you were speaking on, someone was also trying to call. You may want to call back right now if you have question for Dr. Ayodele before we move forward. Good afternoon, Nigeria Info.
Hello.
Good afternoon.
Yeah, good afternoon.
All right. What your name and where you calling from, please?
Okay, my name is Akigbe.
Oh, Madam Akigbe, good afternoon.
Yeah, when I attended antenatal care, they mentioned all these jaundice and eye problem and brain, what do you call it? That center of the brain that always pop up when you born a newborn baby.
Okay, the vernix cardiosa.
Okay, the center of the head, Abi. So he told us that what causes all those one is lack of complete.
We lost Mrs. Aigbe's call. You might want to call back. Lagos will be going on a short break soon. Numbers to forward your message to 0809-597-5805. Let me see if we have messages on WhatsApp already. Good afternoon, Zaynab. I want to ask the doctor about parents putting the baby outside the early morning sun. Does it actually cure it? Because I have seen mothers do that sometimes. Chiweze from Iyanokwaja. Doctor?
No. Chiweze, absolutely not. Early morning sun does not cure jaundice. I repeat, early morning sun does not cure jaundice. It is irresponsible for anyone to just go and hang their baby inside the sun without having checked the level of the jaundice in the name of it will cure the jaundice. No, it does not cure jaundice. It is not a practice that we endorse or support. Go to the hospital if you notice that your baby has jaundice. Let the level be checked and let them let you know that it is a safe level for you to take your baby home. If they say you can put the baby inside the sun after that, no problem. But without getting information that the level of jaundice is actually safe, please, early morning sun is not a remedy for jaundice. It does not treat or cure jaundice in any way, shape, or form.
All right. So I have this one from Folakemi Iyano Iworo. Folakemi says, Zaynab, please, I need you to ask a doctor, is this saying that we should refuse completely from putting our children in the sun and washing the children with proper water, as you mentioned earlier? Folakemi from Iyanoworo.
Yes, Folakemi, emphatically, please, it is irresponsible and it is completely unimaginable that treatment for jaundice involves proper water or hanging your baby in early morning sun. No. If you do not have a jaundice test level, a bilirubin level, please, you have no business putting your baby inside the sun to treat your son or your child for jaundice. Early morning sun is not a treatment for jaundice for the 100th time.
All right. Thank you, doctor. So, doctor, I would love to ask this question in particular. Are there no home remedies or practices that parents should inculcate in a situation like the woman on social media with regards to jaundice at all? I want to know, are there no home remedies at all in this regard? I would love for you to answer that question right after this break. Do you understand the question?
Okay. Let's go on the break and then answer the question when you get back.
All right, Lagos will be right back. We are going on the short break.
Whether you play on oneplay.ng or dial *347
registered trademark under Lasho Trading Services Limited, licensed by the Lagos State Lotteries and Gaming Commission.
Everyone says I'm beautiful and bold. They say I'm fashionable, and to crown it up, very confident. And my secret is...
People say I'm good looking, funny, hardworking, and to crown it up, very confident. And my secret is...
So whether in the office or at home,
in the streets or on the dance floor,
anytime, any day, I never lose my confidence. And the secret to my confidence is Wazobia perfume.
Absolutely. Wazobia perfume gives the authenticity and long-lasting fragrance all day. That's my secret confidence.
Wazobia perfume is available in body spray.
Also available in supermarkets and markets near you. Wazobia perfume, the correct scent.
We're back.
We're back.
We're back.
We're back.
We are back.
We're back on 99.3 Nigeria Info.
Lagos, be a part of this conversation. Can parents manage jaundice baby at home is the conversation we are having. And before that short break, I was asking Dr. Renner Ayodele if parents can manage jaundice at home. At all. And doctor says, here again, from the horse's mouth.
No, there is no place for home management of jaundice in any way, shape, or form. Papa water does not work. Ampiclox does not treat jaundice. So please, when you are being discharged from the hospital, the Ampiclox, you do not need it. And you do not, Papa water does not work for jaundice. Agbo does not work for jaundice. But I find out that there's actually a very strong movement online about people talking about, how our ancestors and how our parents. But you see, the reality is that our ancestors and our parents, they will not tell you about how many children they lost to jaundice. They will not tell you about how many children that they lost, those ones that died. The only stories that you will hear about those ones that survived. And they're probably going to survive because it was physiologic jaundice. Let me please emphasize the fact that, please, you must not rub mentholatum on your babies. Do not rub mentholatum on your babies, because I know that a lot of mothers actually rub mentholatum on the cord. They rub mentholatum on the hands and feet to keep them warm. Mentholatum can cause jaundice. Do not do that. Also, do not store babies' clothes in camphor, because camphor in some babies can actually cause jaundice for them. So please, those things are dangerous. Do not do them. There is no place for any kind of home remedy for jaundice. If you notice jaundice, straight to the hospital to get tested.
All right. Good afternoon. Hi, Yvonne. This is Zaynab. Anyway, this matter of jaundice brought back scary memories for me. When my son was delivered 2 years ago, we were so excited as first parents until a few weeks and a family friend observed and told my wife that the baby's eye colors were yellowish. We then took the baby to the hospital, and that was how we stayed there for 1 month with drips, checking his blood sugar daily, and specialist doctors coming from all over the UK to check him. Thank God he passed that stage and is now healthy, home and doing fine. Good health care system is key, not to be taken lightly. Jumborg from Gloucester. Thank you so much. We are completely out of time right now, but let me see if I can pick this call. Good afternoon, Nigeria Info. Hello, good afternoon.
Hello?
Good afternoon. Please go ahead.
Okay, what I'm saying, my line went off before, is that during the time of antenatal, that is where the doctors need to pay emphasis on some of those things they need to eat that they were not eating before, that will give the newborn baby good nutrients in the womb.
All right. Thank you so much, Madam Haigbe. Time has gone. I would love to say a big thank you to Dr. Renner Ayodele, medical doctor and consultant pediatrician with over 11 years of thank you with over 11 years of active clinical work, research and training. Doctor will bring you back on the show, please. But I would love to say thank you this time. All right, Lagos. Thank you, Zaynab. You're welcome, doctor. Thank you more. Ivana Haifo is live in the studio, and it's time for the news.
99.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info.